the way teeth were moved. You go back to the early 1900s. And one was a bodily movement where you grab a hold of the crown of the tooth and the root, and you try to pull the root through the bone. The other technique was tipping a tooth into a position and then uprighting it. Teeth move more rapidly when we tip teeth. We're tipping teeth to correct a poor bite, and then at the very end we're straightening and uprighting roots so they accept the forces properly. So we're getting the best of both worlds with this bracket. It's the only bracket in the world that allows us to tip teeth and to do bodily movement. With the tip edge technique, it gives us more efficiency, it takes less time, there's less appointments, less costs, plus the end result, and that's what I take pride in, is orthopedically, we're going to have a correct bite orthopedically and also a beautiful smile. If you need 12 to 14 ounces of force to move teeth with the straight wire technique, obviously there's going to be a little bit more force. Using the tip edge technique, we actually use 2 to 3 ounces of force, so there's less force. The kids that come in during treatment, I very rarely hear them say, my teeth hurt, I have to take medications because they ache. And I think it stems from that difference in the force that we use to actually move the teeth.
My son Nick, who at the time would have been 13 and a half, had some pretty bad experiences with something called a Herbst appliance, and he had a very bad football injury, and the appliance actually pierced his tongue and ended up getting connected on the other side of his mouth. So we had to have that surgically removed, and we tried a couple different appliances at these other practices, and quite frankly, he didn't have a very good experience. We did our research, and we found that the tip edge technique that Dr. Aerni offers was certainly the path that we wanted to go down. The result has far exceeded expectations.
We use less appointments to treat that patient because we see the kids once every 8 weeks, once every 2 months. If you're a family, and I know how we are with schedules, if you don't have to go in every month to have that treated, and we're going to do it in less time, less than 2 years, if I can do it in less appointments, less time, it's going to be more cost effective too.
The tip edge technique has made a difference in cost. If you took a look at what we were in prior to in the Herbst appliance, it was going to be probably right around a 2-year process. With the tip edge technique, it was going to be anywhere from that 12 to 15 month range, and cost a little bit under what we were going to pay using another appliance. So we were very happy with the tip edge technique.
We do offer financial options. We work with patients and try to facilitate whatever their needs may be, and we do offer them financial counseling as to what the options are for the procedures.
In order to provide the care that I want to give to my patients, I have to present myself in a way that allows a patient to feel like I'm in the right place. When I designed this office, I went to probably 20 different offices. I wanted an office when they walk in the front door, a patient has the feeling of warmth. It's got a homey feeling. When they walk back into any treatment room, there's windows. We overlook the Metro Park. It decreases stress level. Some of the things we use in the office today that are different from 5 years ago, 10 years ago. It's called a cone beam CT scan for diagnosis. We actually can take a scan, and 3-dimensionally I can look and hold the patient's jaw and turn it and rotate it and look at it and dissect it before we actually would do any treatment. So we know exactly what can be done. That technology is invaluable in surgery today. tip-edge technology that I use today is less painful, less expensive, and often takes half the time of traditional braces.
We really get to know the patient. We listen to the needs and the wants of the patients, and that makes a big difference.
I could tell you that every step along the way has been just fantastic. Dr. Aerni and his staff are very meticulous to detail, and the biggest thing that was most important for my wife and I is they kept Nick very comfortable the whole time through, from day one to where we are today.